This is the last video for chapter 25, and it's on transport, storage, and elimination of urine. So the ureters are slender tubes that are going to convey the urine from the kidneys to the bladder, which just basically means it's going to bring the urine from the kidneys to the bladder. They begin at L2 as a continuation of the renal pelvis. Remember, the renal pelvis is part of the internal structure of the kidney. And the ureters are also retroperitoneal, just like the kidneys, which again means that it's behind the peritoneum. They enter the base of the bladder through the posterior wall. As bladder pressure increases, the distal ends of the ureters, which would be the ends that are closer to the bladder, will close, and this is going to prevent the backflow of urine. There are 3 layers of the ureter wall. This is from inside to out. So the innermost layer is the mucosa, which consists of transitional epithelium. Then the inner layer is the muscularis, which is a smooth muscle sheaths, which are smooth muscle sheaths that will contract in response to stretch. They're going to physically propel the urine to the bladder. So gravity alone is not enough to get the urine to the bladder. They also have to be pushed by peristalsis, and that's going to be done by the smooth muscle in the ureters. The rate of peristalsis is adjusted to the rate of urine formation, and then sympathetic and parasympathetic innervate the ureters but play an insignificant role in peristalsis. And then the outermost layer is the adventitia, and this is composed of fibrous connective tissue. So we have, let's blow this up. The inner layer is the mucosa, right? So this is the mucosa here. Then we have the muscularis, and then we have the outer adventitia. We move on to talk about the urinary bladder. And the bladder is just a muscular sac for the temporary storage of urine. It's also retroperitoneal. It's on the pelvic floor posterior to the pubic symphysis. In males, the prostate is inferior to the bladder neck. In females, it's anterior to the vagina and uterus. It has openings for both the ureters and the urethra, and that's where we talk about the trigon. And the trigon is this smooth triangular area that's actually outlined by the openings for the ureters and the urethra, and infections tend to persist in this region. There are also layers of the bladder wall. The mucosa also consists of transitional epithelium. The muscular layer is a thick destrusor muscle, and it consists of 3 layers of smooth muscle. And then there's also an outer fibrous adventitia, except on the superior surface where it's covered by peritoneum. And this is showing a bladder. Oops. So this would be in males. And we can see the trigon here. So this would be the opening of one of the ureters, the other ureter, and then the urethra. And so the trigon is this triangular area here. And then we have the same thing. This would be a female. So we have the ureter, and then urethra. And so this area is the trigon. So when the bladder is empty, it collapses, and these things called rugae appear, which are like wrinkles or folds. And while the bladder fills, it expands and rises superiorly, but there's not a significant rise in internal pressure. A moderately full bladder is about 5 inches long and can hold about 500 mils or 1 pint. It can actually hold about twice that amount if necessary, but if it gets over distended, it can burst. And so this is showing, so we have kidney, renal pelvis, ureter, down to the bladder. The urethra is a muscular tube that drains the urinary bladder. It consists mostly of pseudostratified columnar epithelium, except near the bladder, it's composed of transitional epithelium, and near the external urethral orifice, it's composed of stratified squamous epithelium. There are two sphincters. There's an internal urethral sphincter. This is a involuntary smooth muscle at the bladder urethra junction, and it contracts to open. And then there's an external urethral sphincter, and this is a voluntary or skeletal muscle surrounding the urethra as it passes through the pelvic floor. Micturition is also called urination or voiding, and three simultaneous events must occur. Contraction of the detrusor by the autonomic nervous system, opening of the internal urethral sphincter by the autonomic nervous system, and opening of the external urethral sphincter by the somatic nervous system. Can't speak, excuse me. That's actually all I have for this video. This is it for this chapter. I hope you guys have a good day.